Hi there, how are you today?
Good. How are you?
I'm doing well. My name is Hannah. I'm a PA student from Methodist University. Can you just confirm your name and date of birth for me?
Yes, my name is Madison Smith. My date of birth is 12/18/1992.
All right, awesome. So I kind of spoke with the nurse a little bit about why you're here, and she was telling me that you were here for some contraception, correct?
That's right. Yeah, I've had 3 kids and I just can't have any more.
I can completely understand that. So I'm going to ask you a little bit about your family history and like some of your medical history, and then we'll talk more about some options, okay?
Okay.
So with your personal history, medical history, do you have any history of like breast cancer, any clots in your legs, clots in your lungs, stroke, heart attack?
No.
And then, and your family, any of those issues like mom, sister, grandmas, anything like that?
No.
Okay. Um, and so do you take any medications daily for anything?
I don't.
Do you see the doctor for anything regularly?
Just my annual visit.
Okay. So no history of like migraines, seizures, anything like that?
No.
Okay. Awesome. So the reason that we ask those questions is because some of those methods can interact with certain medications and can potentiate the risks of some of those conditions. So have you been on birth control before?
I've tried the pill before I got pregnant. I just had a hard time remembering it.
Okay. Okay. Awesome. So yeah, with the pill, there's a couple of like pharmacological, that just means like hormonal options and kind of that category. So the birth control, I'm sure that you take it 21 days, and then you have 7 days where you don't take it, and then you start a new pack. And with the patch, it's a similar option. It's also a combined hormone, so it's estrogen and progesterone. That one, you say you start on a Sunday. You would put a patch on your left arm on that Sunday, and then the next Sunday you would remove it and then put a patch maybe on your right arm. So you just kind of want to switch up the spots that you're using it in. And so then on that third week, then you would use like nothing. So you'd not put a patch on, and then that would be like your placebo week, like you were on the pill. But those do run the risks of some of the things that I mentioned. In the long term, it can cause some cardiac issues, can cause clotting, can cause, clots in your legs, things like that, and things that could cause that to worsen is if you ever develop like hypertension or high cholesterol, things like that can cause that method to not be as favorable as some of the other options that we have. So another option that we have that's a little bit more effective, because the pill and the patch do have about a 5 in 100 chance of getting pregnant, depending on the consistency of the person that's taking it. We do have the IUD, and then there's also the option of tubal ligation and vasectomy. Those run about every 1 in 100 women get pregnant with those methods. The IUD, we'd be able to put it for you here in the office today. It does run the risk of like uterine issues, so it could like cause like a tear or a rupture or something like that. And things to look out for would be like abdomen, like bruising, abdominal pain, heavy bleeding, more than like you would expect. Because when you get the IUD, you can expect some spotting, and you could expect to bleed for a couple weeks. You could see some irregularity in your periods as well, but we'll check back up with you in about 6 weeks if we do put that in, and then you could leave that in for as long as 10 years. And then the tubal ligation and vasectomy, we just do encourage people and let them know that we consider them irreversible, even though there are ways to reverse those things. We just always counsel patients that they are irreversible in the chance that something were to happen and it was not able to be reversed. So if you were to choose that option, just knowing that like if you make that decision, you may not be able to have any more children. So are you wanting to have any more children?
I think I'll try the IUD first.
Okay, you want to do the IUD?
Yeah.
Okay. Do you have any questions for me? I know I threw a lot of information at you.
The IUD, is it easy to come out?
Yeah, yeah. So if you wanted to have more children, like if you made the decision that was something that you wanted to do, we could totally, you could come in and we could take it out for you.
Awesome. Okay, sounds great.
All right, we'll go get that for you.